how about other rhythm problems that we see frequently as people get older? Atrial fibrillation, what is that?
It's very common. That's when the upper chambers no longer have organized beating. So lower chamber, upper chamber. The upper chambers just wiggle. They wiggle, and that's what we call fibrillation. And it's fairly common. We see it as people get older and also with some risk factors like high blood pressure.
So if you've got atrial fibrillation, what do you do?
Well, one of the most important things with atrial fibrillation is the person needs to be assessed for blood thinner because there's an increased risk of blood clots.
Why is that?
Because the atria are no longer pumping and that blood is a bit stagnant in the upper chambers.
So it's the upper chamber that can get the blood clot.
Yes.
That flips it up to the brain.
Right. So that blood thinner is very important because it prevents stroke. And that's number one of importance. Other things are whether or not to be on medications. Sometimes there are procedures. And so there's a variety of ways to tackle the problem.
So tell me about ablation. What would that be? And would you ever use ablation in atrial fibrillation?
We do. So ablation is there to interrupt that extra heart rhythm, and it's a catheter procedure. It's to interrupt the extra heart rhythm, and it has a pretty good success rate.
So if you have an ablation and it's successful, the heart rate's normal, and you can get off your blood thinner?
Perhaps. We have to observe you for a period of time.
So it's always a problem that it might come back and cause
Right,
problems
it might come
like
back.
that.
Mm-hmm. Yes.
So chronic atrial fibrillation, what is the rate normally with that?
Well, it varies. We oftentimes give people some medication, like a beta blocker or calcium blocker, to slow the heart rate down. But chronic atrial fibrillation can have a fairly normal heart rate in the 70s, say, and that would be very acceptable.